Hi everybody, it's Tony. This is a video made specifically for a post-knee replacement patient that is somewhat far out. This is not necessarily meant to be an exercise video that is generalized to everybody with a knee replacement recovery. I know this patient in particular, so if you happen to wander onto this video, not all the exercises here are structured for you. You do have to go to a regular physical therapist, be evaluated, go through the whole system, because this particular patient is fairly well established now in their program, but these are where she needs to be at. By all means, subscribe, like, whatever you want to do with the video. Ask me questions if you want in the comments section. I'll try to get back to them. So let's just get ahead right to it. So I have included 15 different exercises, and I'm going to put them up like this. So if you would like, please go ahead and copy those down. You can go ahead and pause the video and write these down. That way you can take notes while you're watching the video for later. And let's get the last couple there. Again, just pause the video. There's a little pause button at the bottom of the video that you can hit to write all those down. Okay, that way you have them handy and you know what I'm referring to. All right, let's get to it. I also want to preface this by these might not all be exercises that you can even do yet, but the idea is to progress to the point where you can. So the first one is prone stretch with belt for knee flexion. So you're going to want to get on a flat surface, not the ground, more likely a bed. I have a bench here, so I can use the bench. You're going to want to get a belt. It doesn't have to be a nice store-bought stretching belt. I already have one, so that's what I'm going to use. You can use a regular belt, or a rope. Any of that would be perfectly fine. I'm just going to be doing it on this leg so that you can see it for convenience, but you're going to be using it on your knee replacement leg. I'm going to make a loop because I'm going to make it easy for myself. You can make a loop as well. Okay. So getting into prone, that's flat on your belly. And the idea is, in particular, you want to have your thigh on the surface of the bed. And what you're going to do is you're going to try to bend the knee as much as you can into flexion. Now obviously, if you're only at this point, this is as far as you can go, you're going to want to pull like this to try to bend your knee as much as you can. Now obviously I have range of motion. You probably don't have that range of motion, so you're probably going to be about here. So you're going to get that bent to about there, whatever is still comfortable, and you're going to hold that position using your arms to hold it in place. All right. Any of those stretches that I'm giving you should be done for at least 1 minute. If you're not holding it for 1 minute, you're not stretching it for a long enough period of time to actually make changes. Number 2, standing stretch with step for knee flexion. So I know this particular patient has access to a set of stairs. So what you're going to want to do is get on to the steps, one hand on the railing, one hand with your cane, put your foot up on the step, and then while holding on, bend forward. And you can see how by doing that, I'm bending my knee more. Okay, now this doesn't seem that particularly aggressive because it's a low step, but the idea is to go to the second or even third step in order to get the leg up there high, and now holding on to the railings, you have good control you can see how now I can bend the knee even further for more range. Okay, again, getting a nice good stretch. It's not supposed to be hurting. Holding it for at least 1 minute. Okay, so it's not on again, off again like I'm doing. You're gonna get there, hold it, and hold for a whole minute. Okay. Next, standing unweighted knee flexion stretch with the belt. Get to a position where you can be comfortable to hold on to something. Maybe it'll be a railing, kitchen sink. I prefer not the wall because you can't hold on to anything for stability, but I have a wall here, so I'm just going to use it. And the idea is, once again, I'm going to take the belt. I should really show this off correctly. And I'm going to do this. And again, this is just a way to conveniently stretch out your knee without having to get down on the bed. And again, I can get my heel pretty up close towards my butt with this stretch. Okay, again, holding for 1 minute. Another way to do this is without the belt altogether, grabbing a hold of the shin, and again, bringing the butt and the heel close together like that. And you don't have, I don't want you to go like this necessarily. That's unneeded at this point. Just like this. Again, holding it for 1 minute. Again, that's something that you're going to progress to. So you're probably going to need the belt now. Down the road, you'll be able to do that stretch without the belt. Next, supine stretch with belt for knee flexion. So let me bring out this again. Again, I'm going to put my belt in place. So you imagine I'm on a bed, fully, not just a mat, not just a bench, but a bed. And what I'm going to do is I'm going to have that belt around the ankle. What I'm going to be trying to do is being able to bend my knee the same way that I'm bending the other one. So maybe I'm at 90 now. The idea is to pull, 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 pull. Pull it even more, and then hold it there. So again, my knee flexion occurs. I'm just going to hold that position. Okay. Again, any of the stretching, holding for at least 1 minute at a time. I'm giving you a variety of these so that you can find one that's comfortable to do. I find that the prone stretch with the belt, which is exercise number 1, is probably going to be the most effective at getting more range at this point. But again, not everybody is comfortable with that. Next, the supine stretch for knee extension / hamstrings. Number 6. I'm going to be laying down flat on the bed, grabbing behind my thigh, not behind my knee at this point, and just getting to a hamstring stretch. You have probably seen this stretch done before. You can also do it with the belt to help out. Again, I'm had a lot of focus on the knee flexion, but knee extension still needs to be done. In particular, stretching of the hamstrings in particular. You should be doing hamstring stretches on both sides as well. Again, trying to get good range. Okay? I don't have to go very far to get a good stretch because I have limited hamstring flexibility anyways. Next, seated hamstring stretch, which is number 7 on the list. Let me take the belt off. So, I think I've probably shown this one before. you're going to have your knee in a straightened out position. Let's get back here so you can see it. Like this, you're going to keep your back straight and you're going to bend forward at your hips to get the stretch. All right, you do not have to go really far to get the stretch if you're doing this correctly. So if you're holding your back straight and just bending at the hips, I go this far forward, I'm feeling the stretch in my hamstrings. I don't necessarily need to go any further than this. Okay, lots of other pictures, demonstrations have the person going all the way down, trying to get their knee onto their patella. You don't need to go that far. Just being able to stretch the hamstring. Once you feel the stretch in the back part of the thigh, you're golden. Holding that for 1 minute as well. Number 8, the straight leg raise. I believe this may have been in some of the exercises you've already been given, but it's a very important exercise, so we're going to go over it again. Straight leg raise looks like this. Looks easy for me to do. After knee replacement, not so easy. Let's go over some things. When you're doing the straight leg raise, you're not just trying to lift the leg up, you are trying to keep the leg straight, thus the name. So you want to contract your quadricep muscle, that's the muscle on the top. Squeeze it real hard as if you're keeping the knee straight. Literally you're trying to bring the patella up towards you this way, keeping that knee completely straight, while maintaining that quadriceps contraction. Then that's when you want to lift the leg up and back down. Then relax. Okay, so let's go over that again. You contract, hold, and maintain your quadricep muscle straight. Lift the leg straight up, slowly come back down. That's the straight leg raise. Should probably aim for about 3 sets of 10, alternating sets of 10, one leg then the other. That's for strengthening. It's a pretty important exercise to be able to complete because of the nature of a knee replacement, of where it's located. These are the muscles and structures that have gotten cut. So these muscles need particular emphasis for your recovery. Next, weight shifting, medial, lateral. Let me get this out of the way. This is number 10. You're going to have your feet more than shoulder width apart. In fact, even more so. Okay? And what you're going to be doing is shifting your body weight from side to side. Now, as you can see, my knee is going to bend with this. But the idea is I'm not dropping my weight down, I'm just translating it from side to side. Okay, you don't necessarily want your toes pointed straight ahead. They can be angled out in a V. And again, I'm going side to side for stability, medial lateral stability. Okay, you're going to need to master this one before you move on to some of the other more complicated exercises that I have left for us. Next, this is number 10, weight shifting anterior posterior. So you're going to be basically getting into at least shoulder width apart width, and you're going to take one big step forward. Doesn't matter which one, because you're going to be doing it, you're going to be switching it. And what you're going to be doing now is not a lunge, but again, a weight shift. So I'm not letting my body weight drop down. I'm having my body weight go forward and back, anterior to posterior. That's what this means. That's what anterior and posterior mean. All right. So you're going to do it one with the leg, affected leg back, and you're going to do it with the affected leg forward. Let me demonstrate from this side. Again, again, I'm in a near lunge position, weight shifting to the front leg, weight shifting to the rear leg, back and forth like this. At this point in your recovery, if you need to use cane and countertop or kitchen sink together for that stability, then go ahead and use them. But the idea is you want to progress to the point where you are not using anything at all, just maintaining your own body weight like this, okay? Number 11, step-ups. You'll be doing this on a set of stairs that I know that the particular patient has access to. But at first, if you can't do this just using the muscle strength that you have in your legs, you're going to want to have one hand on the railing, one hand on a cane. Okay, I'm going to have at least one hand on a cane just to demonstrate. So it's, in the past, when you've been going up and down stairs, I've taught you put the good leg up. So this is, let's say, this is my non-knee replacement leg. I'm putting my good leg up to do the step. Well, that's not going to be forever. We want to make the right leg the good leg as well. So you're going to be putting your knee replaced leg, the post-surgery leg, up on the step, grabbing a hold of the railing and the cane, and using that to move your body weight up. And then placing the other foot back down. And repeat. Because what you want to be able to do in the future is be able to do steps and stairs without any support at all. So that you can just go upstairs, one right after the other repetitively, without any external support whatsoever. Okay? Obviously, if you go up 2 steps, it's going to be harder to do. Start with 1 step or a low step and build up the height as you can. Next, lateral step-ups. And this is a pretty important one that I feel doesn't get the mention in a lot of therapy programs. But I have people do it because it's pretty important. Instead of going and facing your stairs directly, you're going to stand to the side. You're going to put the affected leg up and go up that step. Now, I'm only doing it on the side of this step because more than likely you don't have a step that you can put both of your feet on. But if you have enough room to put both feet on, go ahead and do so. But it's going to look like that, going out to the side. All right? So more than likely the position for your handrail is going to be right here. The wall is here. You're going up to the side, not facing straight up the stair, but to the side. So that's your lateral step up. Works a lot of your medial lateral stability, which you need at this point. Lateral step-ups, that was number 12. Number 13, calf raises on the step. Now this is not so much a knee-specific exercise, but it's important to start getting back into doing this anyways. So you're going to be standing on a step, one hand on a railing, one hand on a cane, and you're going to be having the heels come off the edge of the step so that you can put the calves on a stretch, and then you're going to go up onto your toes, doing calf raises like this. Let me demonstrate from the side so you can see what I'm talking about. not the most stable step for me to demonstrate on. But again, okay, I'm on the step. I want to put just the balls of the feet on the edge of the step so that my heels can drop down. Whoop. Like that, going up. So my heels are not supported. My heels are not supported throughout the movement. So that's your calf raises on the step. Next, the sit to stand progression to the box squat. So with my conversation with this particular patient, they have not been able to master sit to stand without the use of at least one hand yet. So here is the progression. We want to be able to do a full squat in the future. There's no reason why somebody with a knee replacement cannot do a squat in the future with the proper training. I mean like this, okay, where the person's going to drop down their body weight, go all the way down and pick something up. Okay, that's a full squat. That's what we're trying to be able to get to eventually. At this point, I'm happy and content with being able to stand up and sit down from a chair. So the idea is, you can obviously at this point get up using your hands. What I'm going to have you start doing, put your hand on your chest like you're saying Pledge of Allegiance, or like you're going to impersonate Napoleon, and use only one hand to get up. Like that. You're then going to progress to two hands on the chest to prevent you from trying to use them, sitting down and standing up. A way to help you with the progression for this is start off on a chair with a higher seat height. Add a cushion or a pillow to it as needed. Once you've mastered that and you have the strength from the higher seat height, go to the lower seat height. Okay, don't just start off with the lower seat height and feel like you can't perform the exercise. Don't start off that way. Start off with something that's going to be successful to work with the range that you have, and then lower down the seat height. Eventually, what you're going to want to do is get to the point where you're doing the box squat, which looks just like this, where you're going to be touching your butt up against the chair and coming right back up. So it's not you're not actually going to be fully sitting down. It's just a touch, come back up. So this is sitting down in the chair, right? And then coming back up. This is the box squat. Touch it, come back up. Touch it, come back up. So the box squat is still a safer exercise to do than a full squat because you still have the chair or the surface there for you, so that you know if, hey, I really can't do it, my knee really can't hold out anymore, and you can just sit down and relax, okay? If you're doing a full squat, you don't have that option, and you're going to be on the ground. So progress to doing the actual squat in this manner, making sure that you should be able to do the box squat really nicely before doing a full squat whatsoever. So that was number 14, the sit to stand progression. Number 15, lunges. We're going to keep this with a real simple lunge. Cane, kitchen sink or countertop. You're going to get into the lunge position, which is 1 foot forward, 1 foot back, nice and wide apart. Now this isn't going to be like the weight shifting. The weight shifting should be mastered first. So if you haven't mastered the weight shifting anterior to posterior, you're not ready for this. What you're going to do with the lunge is translate your weight down and back up. So you're going to be bending at both knees and coming back up. So like that. I'm going to demonstrate from the side. Lunge position, going down and back up, and doing repetitions of those. Let's just say aim for 3 sets of 10, just so that you have a number to try to shoot for. And it's going to be switching the legs. So you're going to be doing it knee replacement side forward as well. Again, doing the lunge, translating the weight down and up. Okay? You're going to want to eventually get to the point where you are not using the cane or any handheld support. That might take a while to get to that. Time is up to you. It's about how much you put into it. Last one, number 16, lateral lunges. So I'm going to start from a standing position, and this is where the medial lateral stability exercise, which was number, which one was it? The number 9 exercise on the list comes into play. You're going to have the countertop in front of you, countertop in one hand, cane in the other, whatever you need for support, and it looks like this. You're going to step out to the side really far, translate your weight down, come back up, step back. In fact, if you really want, you don't really even need to step back. You can just keep it in this wide position and take the step out of it altogether. Okay, so you're going not just down, but down into the side. And of course, you're going to want to do it on both sides. Again, just to keep things even, keeping the other side strong as well. Okay, so lateral movement to the sides, coming back up. Okay? So those are the 16 exercises I feel like are important for you to be starting to do right now. You can mix them into the program that you're already doing. I will emphasize though that the prone knee stretch, the number 1 that I put on the list, I want you to be doing that one in particular because you need to get your knee flexion better. You already have done a great job so far. You need to do more of that one in particular, okay? So if you stayed through with the whole video, know that you can go back and go to different sections as you need to. I know it's a little bit longer than expected, but this way you have things to work on for a while before I need to upgrade your exercise program again. That's pretty much it for the patient. If you happen to stumble upon this video and need more information, again, talk to your healthcare provider, in particular a physical therapist, if you've had a knee replacement and need exercises. If you have questions regarding knee replacement exercises and or the recovery for it, put them down in the comment section if you happen to come across this video. I feel like there's probably a good chance that the only person that's going to be watching this video is the person that was directed to watch it anyways, but if you happen to come across it and you have questions, I'll try to answer as best as I can. Please note that I'm not always checking videos because I have a life outside of doing YouTube, so I'm actually seeing patients. So I'm not always checking YouTube a whole lot, I don't live on it, okay? So outside of that, thank you for watching. Patient that was designed for, once you watch this, if you have questions, also very important, go over them with me. That's why I wanted you to pause and take notes as needed, okay? Thank you, bye-bye.